there's one part of the interview which in some places they can offer a roleplay scenario. So this is often something where you sat down with an actor or and there's an examiner in the room, or something like that. And this is just, again, you could be given a scenario that you have to act out, or you could be given a task, or something a bit more practical than just answering a question. So some examples could include sort of taking a medical history. So you're told to sort of sit down with an actor who's playing a patient, and you've got to take their history. Sort of, it might be a good idea to look at some sort of history taking, points, and just to have those in the back of your mind, so you're able to have some sort of structure to the scenario. You might have one such as breaking bad news, and this is looking at your sort of communication, empathy skills, showing that you're actually able to sit down and talk to someone in such a calm way, and being able to break something where you don't know how the person's going to react. They could be absolutely devastated, or they could get really frustrated and angry, if it's some sort of medical problem that's gone wrong and led to death. So it's just knowing how to deal with that, and how to deal with the sort of uncertain outcomes of how the patient's going to react to you. It could be giving someone advice. This might be another colleague or a friend, or and it's almost taking into account the situation that you're in, because if it's a friend, you could be a bit more colloquial, a bit more chatty, because it's completely different how you'd speak to a friend as you would to a colleague, whereas with a colleague it'd be a lot more professional, sort of. Again, it's understanding the context of the situation, and how, again, it's understanding how the other person would react, and it's just really trying to understand them and working your answer around that. So it might be helping someone to overcome a drug or alcohol addiction. So this, again, is similar to someone seeking advice. It could be a role play within a general practice consultation where you're the GP and have to give advice to that person. So it's good on things like that, maybe to have some facts in the back of your mind, sort of knowing how many deaths are related to drug and alcohol abuse per year, or maybe even something like smoking. So it's just good having those ideas in the back of your mind to be able to recall them, because being able to use facts, it sort of, again, gives you an extra angle to the answer. And again, it's also taking into consideration empathy and understanding of the patient and what they're going through, because it's also nice to have an idea of the fact that it might not just be a standard drink or drug addiction. It might just be something underlying, maybe a mental health condition, maybe something's gone wrong and that's triggered the issue, and it's just looking around it rather than having a closed mind. It's thinking outside the box when you answer things. It could be speaking to a family member. Again, this is a bit more sort of colloquial and relaxed. If you're talking down, speaking to your mum in this role play scenario, it's a lot more chilled, it's a lot more relaxed. And then there's one, and it's speaking to a mute person. This is looking at different ways of communication and showing that you've got the ability to work your way around maybe difficult scenarios, because a mute person won't be talking back. So communication will have to be a lot more sort of expressive, and you'll have to be able to understand that person without them speaking. So it's looking at other factors rather than just talking. It's other factors of communication which are really important to consider in consultations. So again, the key to role play is just don't lose your temper. If the patient starts getting angry or frustrated, don't show it back to them, because again, that just shows that you can't control your emotions, and that maybe it just shows a resilience issue with, if this was to happen in real life, that could then result in a complaint made against you. It's showing active listening, so sort of nodding along to what the person's saying, and sort of giving feedback to what they're saying, really listening to what the person's trying to tell you. So it's not just sitting there and just listening and not saying anything. It's sort of really trying to understand the situation, because again, this is a key factor as a doctor. You've got to have active listening, because if you're not actively listening to your patients, then you're not going to get the maximum that you can out of the consultation, and the likelihood is you're going to miss something. So again, really get into the role and treat it as though you're really in the scenario yourself, because at the end of the day, you might feel stupid doing it, but it's a maximum of 10 minutes, just really trying to immerse yourself in the role and just really trying to get into it. And you know, you might seem that it's being a bit sort of forced, but you know, at the end of the day, when you're there in a consultation in real life, then it's going to be a similar thing. You're going to have to, you know, really get into the situation. So again, adjust your approach to each scenario. So as I said, you talk to a family member or a friend completely differently as opposed to, you know, a work colleague or your boss. So it's just important to sort of understand that and be able to adapt your role, sort of the way you talk, you know, the language you use. For example, being in a consultation, you'd reduce your jargon if speaking to a patient. Right, if you're speaking to another medical colleague, you'd still use that medical jargon because you're on the same terms and you both understand it. So there are some like key factors that are important when being in a role play, and one of them is sort of empathy. So empathy, there are a few sort of like key phrases and buzzwords that you can use. So examples of empathy, again, it would be sort of breaking bad news, or maybe trying to talk to an upset friend or something along those lines. So it's sort of, again, useful to use these alongside active listening. So saying things such as, I understand this is distressing, you know, I can see you're in pain, especially if you're talking to a patient who, you know, they might be in chronic pain and, you know, really debilitating for them. So it's important to show that you're picking up on these cues and you're not just presuming that, you know, they know you're in pain. It's important to show that you know that they're in pain. And it's things such as, oh, sorry you feel that way, that must have been terrible. And sort of, again, it's just active listening skills. So saying like, okay, I see, you know, I understand that, yes, of course. So again, this is just something useful. It's a useful thing to sort of pick up again if you sit down with a friend or something, or again, someone who doesn't really know you that well, and just get them to roleplay a scenario. Because again, they can maybe pick up on factors that they'd want you to use, or that would be better for you to use next time. And you know, again, as mentioned earlier, so sometimes, especially with sort of role play and displaying empathy, it's good to sit down with someone that you might not know that well. So as sort of mentioned earlier, those kind of people are able to pick up on more sort of cues and might be able to prompt you a bit more on what you should and shouldn't be saying. Because often with family members, they're used to what you like and what you're saying. So again, just have someone a bit impartial and a bit different, and that could be really helpful. So some other tips for sort of empathy. It's sometimes good to have silence. Although active listening, it is good, but say if, you know, the person on the other side of the role play is being quiet, it's sometimes good to sit there and let them think, or let them cry, and let them, you know, just let them diffuse for a while, because sometimes, you know, that's good, and that it's not awkward, it's good, and it's should be encouraged to some degree. Obviously not extensive silence. It should, you know, have a happy medium. Another issue is don't touch the person. It might be tempting to sort of put your arm around them, or, you know, sort of rub their back, or, you know, but again, that can be a bit of a sort of red flag, because it's just not, you know, it's sort of impeding their personal space, and that might be frowned upon. Another good tip, if the person starts crying, if there are tissues on the table, just little things like that you're able to think of, and, you know, hand them a tissue. You know, it's not, you know, again, it's not fake, it's not false, it's just trying to show yourself in the best way possible. And, you know, in real life, if someone was crying, you know, you would give them a tissue. Just because it's an interview, it doesn't make it any different. So again, just try and be as real as possible. So there's an example here of convincing someone to stop smoking.